All right, so today we're gonna talk about starts. So this is gonna be a start appointment video. I'm gonna start with the one that we do less frequently, which is phase one. Now, here at this office, we like to treat when all the adult teeth are in. And if that's not the case and we're treating younger, right, which is probably like, so typically all the adult teeth come in around 12, 13. But if we're treating younger than that and they have mixed dentition, baby teeth and adult teeth, that's called phase one start, all right? Now the reasons that we start phase one starts is if it's absolutely necessary. So we don't treat those phase one, those patients so young unless it's absolutely necessary. Absolutely necessary meaning that they have something that we can correct when they're young so that they don't have greater problems in the future, or it's not more difficult in the future. For example, we do this for cross bites, under bites, if the mouth is too small for the amount of teeth that they have. So we do it for all of those scenarios and more, but those are usually the common ones. And I'll give you just an example with an underbite. Now an underbite is when the patient's bottom teeth go like above the top teeth when they're biting down. An underbite kind of looks like this. Now, if you can correct an underbite when the patient is young, that could prevent them from having to get surgery in the future. It would be amazing to do that. It's amazing to take part in that because the surgery is quite invasive. So it's really nice to be able to do this preventative treatment for the patients and get them going with that and fix that problem for them when they're young so they don't have to deal with greater problems in the future. And that's why phase one is very important in those cases, those absolutely necessary cases. Now let's just skip to what we need for the phase ones. And what we need for the phase ones is initial photos, right? Verify that the patient has had a pano within a year, all right? We're gonna go ahead and read what they need on the next visit note. So see, the doctor already did the consultation and he has all his notes, or she, I also work with a female doctor, all their notes are written on their initial consultation visit. So you are gonna know what we need to do today when you look at that note. Whether it's a start RPE, whether it's starting braces, all right? You're gonna know what you need to do. So if it's a start RPE, which is a rapid palatal expander, I said this video was gonna be 2 minutes, it is not. A rapid palatal expander needs impressions. So now we're at 3. Impressions, fit bands, it needs separators, and we already took those initial photos. So what do we need for a phase one with a appliance? It could be whether it's a bite plate, an expander, whatever the appliance is, we need to verify that they have a pano within a year, initial photos, an impression without the bands in this office. If your office, if this is like another person watching this video, that's awesome. There's some labs that would like you to put the bands on. Our lab that we work with, they don't require us to, and in fact that they want us not to put the bands on because the experience of different assistant varies. How they fit bands varies too, and how you fit bands directly affects how the appliance goes in. And so sometimes the lab doesn't want to take that risk. Our lab is like that, the one that we work with. So we take the impression without the bands on, okay? So initial photos, pano, bands, verifying that the pano is there, because usually we take that at the consultation visit, fit bands, impression, separators. That's what we need for an for appliance, okay? Now, if we're immediately starting with braces because they don't need expansion, they don't need the bite plate, they don't need any appliance, we're immediately starting with the braces and gonna get a kick start to fixing that underbite or whatever it is, or crossbite, whatever it is that, and they don't need the expander. Sometimes they do, even in those scenarios. We're gonna go ahead and we're gonna bond the laterals, the centrals, the laterals. We're gonna bond one of the baby teeth. Sometimes he does 2, most of the times we do 1, and usually it's A and J. And then we're also going to prep the first molars, all right? So that is what we need for a phase one visit, okay?